Hi, everyone. Thank you so much for joining the webinar today. This is the launch for our newest family member of navigated retinal lasers, the Navilas 577 Pro. We are excited. My name is Sarah Wolfe. I'm the U.S. Clinical Applications Manager for ODOS. And so we'll get right to it. Quick agenda overview. Next slide, please. Thank you. So quick agenda overview. Today's webinar is going to be about 30 minutes of slides and case presentations, followed by question and answer session. Also know that you can type in the chat function as well if you have any questions in the webinar. That's also okay. Okay, so I'm also pleased to welcome our presenters today. We've got Dr. Robin Ross of the Global Retina Institute of Arizona. Dr. Ross is going to be sharing some interesting cases and some insights into her use of navigated laser technology. So thank you, Dr. Ross. We appreciate you being here today.
Thanks for having me.
Yep, no problem. Also, my colleague, Dr. Bernard Lobmeyer, is also going to be presenting the Navilas 577 Pro software demonstration. So thank you for that as well, Bernard.
Good afternoon. Hello.
And then later, I'm going to circle back and walk everybody through our Navigate app. It's basically an iPad app that ODOS has developed to aid institutions in laser surgery education. So, all right, next slide, please. So the navigated laser is the next generation and step up from pattern laser. And today we would like to introduce you to the newest member of the family, the Navilas 577 Professional. It's a fully digital system. It's precise, reliable, fast, and comfortable, and it's based on the unique advantages of navigated technology. We're pleased to offer Navilas Pro at a new price point starting at $75,000, and therefore it's economical as well as efficient for most important retinal laser applications and more. Navigated retinal laser technology has now proven itself in clinics and medical practices worldwide. As you can see here on this next slide, we have a small excerpt of the institutions that Navilas calls home. As you can see, the users include large university clinics in countries such as the USA here, Italy, Japan, France, and Germany, but also public hospitals and private practices as well, as with Dr. Ross over in Arizona. Dr. Ross has been in a combination private practice and teaching at a university for over 20 years. Her private practice is focused on retinal medicine, but patients and clinical research trials and global health. She's the global director of the outreach at the University of Arizona College of Medicine in Phoenix. So as promised, now I'm going to go ahead and head it over to Dr. Ross here. So please introduce yourself and sort of give us an overview of your philosophy.
Yes, thank you. I've enjoyed retina practice, but have more of a concierge take with our patients here in Scottsdale. For 20 years, I practiced next to Flint, Michigan, and took care of a very large underserved community of about 10,000 patients in our practice, and then transferred that practice to University of Michigan. So used to taking care of a lot of second opinions, third opinions, monocular patients. So I'd always used multiple different laser modalities in my office and was one of the early adopters on the innovation curve, and adopted Optomedicus Pascal right when it came out. Found that it really expedited care and there was a lesser pain threshold. I was very interested in navigated laser when it first came out. And when I opened the practice here after a 3-year sabbatical working on Ebola, that was the first laser I looked at, was the navigated laser, because I really wanted to be able to treat monocular patients and be able to map it. And the idea of focal laser treatment that could be navigated with a non-contact system was exciting. So I'm very pleased with the navigated laser we've had now in deployment for about 2 years. I don't see a lot of patients. I do about 20 lasers a week, and I found this laser to be enjoyable in terms of taking care of peripheral retina pathology, which I didn't expect. I've had a lot of patients who have had a bad experience with PRP or indirect laser for tears and lattice, and I found it to be very helpful in terms of using the screen, very comfortable. I'm not hunched over. and being able to document with clarity either pre-planning. It's expeditious, even though I don't require speed at this juncture in my career. But I love the fact, and patients do as well, that it's taking an image of their retina and then we're mapping where the laser needs to go. A lot of patients have a lot of anxiety when it comes to having laser, and this is a much more comfortable, low pain threshold laser. Next slide. I would like to present a couple of cases. This is a 43-year-old woman, high myope, who had lattice degeneration with atrophic holes in both eyes. She came to us after having indirect laser in her other eye, and she felt that the pain scale was an 8 out of 10. And when we approached her about having treatment with the Navilas, she was a little hesitant, but went for it. And when we were done, she said, "Oh my goodness, this was awesome. I wish I'd had my other eye done that way." And she didn't have any after problems with scotomas or gray field of vision loss like she did when she had indirect laser. And she was just overjoyed and very grateful that we'd actually used navigated laser to treat her. And so you can see up on the left, lattice patch with atrophic holes. We've surrounded it and we've put no-fly zones, as we call them, so the patient wasn't worried about having looking in the wrong direction, having macular laser or the optic nerve lasered. You know, today patients go to Dr. Google and they read about all kinds of horror stories involving laser. And this is really a way to allay their fears. They understand drones, and so we actually use the concept of their retinal vessels are a unique fingerprint for them, and the camera and the system will allow the laser to direct it in the exact area of precision that's needed to treat their pathology. Next slide, please.
Okay, so I guess we're moving on here. Thank you, Dr. Ross. I did have a quick question for you, if you don't mind. You'd mentioned to me at one point that you actually have patients that specifically come to you for Navilas, that they travel to you from distances. Is that the case?
It is the case. We've had patients do homework online and contact us and ask us if we actually have this system, that they may have had a complication with focal laser, or they've had a painful experience and they've heard that this might be the easier route to go. I've had patients who travel from Canada. I've had a patient come from Alaska. And a lot of patients who have come from New Mexico. So patients are hearing about it, traveling, and they'd like to have a more comfortable experience. And they do read your reviews online, and they did read Kara's review, and we did get 2 or 3 patients as a result of that. So
that's great. Thank you. So I guess we're going to move on here. We'll come back to you here in a little bit with some more case presentations. But for now, we've got some details concerning the Navilas 577 Pro and its unique advantages. So I'm actually going to hand it over to my colleague now, Bernard, for his part.
Yeah, thank you, Sarah. So yes, we are pleased to present the Navilas 577S Pro to you today. This is a new system that combines the advantages of the pre-planned, tracked, and therefore very precise lasering with the established standards that you know from conventional pattern lasers. By integrating the Navilas technology into your workflow, you can not only reliably achieve more consistent treatment results, but also efficiently cover the continuing need for laser treatments. Anybody who is familiar with the operation of a scanning laser ophthalmoscope, of an SLO, can also use the Navilas. Can we move to the next slide, please? Yeah. So you don't work with a slit lamp image that only visualizes a small section of the retina and upside down at that, but instead you have got a fully digital image with high resolution right up into the periphery on a live screen. You've got the fast and efficient planning options, also ad hoc treatments that you can do So whatever comes your way, whether you've got the time to plan your treatment or whether you need to jump into a treatment right away, you've got greatest efficiency at your fingertips. If you want to do complex treatment schemes, they can be implemented here with the simple ergonomics of the system. And with the keyword ergonomics, if you think about it, it is quite different from the conventional setting of a slit lamp based laser system. So this system is very gentle on your neck, and also any individual hygiene measures that you want to observe when you are treating patients can be implemented on the Navilas system without any issues. Next slide, please. So the retinal tracking is one of the key features of the Navilas technology. It enables maximum precision. So you are able to place the laser pulses exactly where you want them. And due to the real-time scanning of the retina, you ensure that the spots go where they need to be. Ultimately, this also helps you to ensure consistency. Even if you've got multiple users in your clinic or practice, you can ensure that the treatments are carried out in a similar fashion across users. We offer with the Navilas Pro the fastest PRP on the market. So you are definitely faster than with conventional pattern lasers. And when you're doing that, you also ensure that you have equidistant spot placing across the whole retina. It's quite different in that from conventional pattern lasers. You don't have to move from pattern to pattern, but you plan your entire treatment. If you want to omit blood vessels, you can quickly erase those with a eraser tool along the blood vessels. So it's really fairly simple to use, and we are going to have a look at the treatment workflow in a couple of minutes. We don't just make those claims, we also have information to back them up. So the spot application on the Navilas system works almost twice as fast as with conventional pattern lasers. So this really shows the advantages of real-time retinal tracking that we operate on the Navilas system. In other words, you can do more extensive treatments in less time, or treat more patients ultimately if that is your goal. Next slide, please. One important aspect, and Dr. Ross alluded to that earlier, is the pain experience that the patients go through. The Navilas treatments cause significantly less pain to the patients. At the bottom of this slide, you also see a reference to a literature review webinar that is available on our web pages. Next slide, please. On this slide, we see a user video out of Paris, France, where Dr. Amoroso is planning a treatment on the screen. You can observe her planning out the treatment. She simply paints on a touch screen. She then places the contact gas on the patient's eye. You can see the retinal tracking on the live screen up the top left. We're going spot after spot. Then the tracking catches up. Now we have got the video paused. Maybe we can reactivate that again. Thank you. So spot after spot is being applied, the retinal tracking in action. And ultimately, we almost have 800 laser pulses applied in under a minute in this treatment. Yeah, you see the spot count. We are now at 750 odd spots. Let's move on to the next slide. So a few sentences on the economic efficiency of the system. I think in today's webinar, nobody has to be convinced that there is still a need for laser treatments. Lasers are still a necessity in the toolkit that you use. With Navilas, the number of necessary injections can be significantly reduced, while at the same time using Navilas ensures that you've got better therapy adherence by the patients. This is also reflected in the economics of the systems ultimately. So while the number of injections per patient may be reduced, the adherence of patients that remain in treatment and ultimately the adherence to your practice or your clinic increases your patient numbers. So simply put, keep more patients through higher therapy adherence. Another aspect to consider is micropulse and also what we like to call long pulse pattern laser. Both benefit uniquely from the real-time eye tracking. Micropulse patterns can be applied in a truly confluent fashion with alternating spot application, ensuring significantly less risk of under or over treatment. And whereas conventional pattern lasers have a maximum pulse duration of 30 milliseconds in pattern mode, Navilas can do conventional long pulses, such as 100 or 200 milliseconds in fully eye-tracked patterns. So that's unique. No other system can offer you this functionality. This brings us to a presentation of the Navilas Pro user interface. On the Navilas system, once you have entered your patient demographics, you put in patient name, confirm, you select what type of treatment you want to do. You select the contact lens that you want to perform treatment with. In this case, we select the focal grid lens. We take a snapshot of the patient's retina. We are able to import from third-party sources diagnostic images. In this case, we have an on-pass infrared image of the same patient's retina. We can compare between those images. We can have the external diagnostic images guide our planning process. The planning takes place on the Navilas generated snapshot. We apply the no-fly zones or caution zones. We apply the treatment spots that we want to perform later on. Then we activate the laser. We go into laser ready mode and apply the treatment. Once we have completed the treatment, we perform another snapshot and we go into the reporting functionality. We've got all the treatment parameters available in a one-page report and sketches of the patient's retina where we are able to manually insert annotations, the areas where we have treated. And of course, this can be printed off. A comparison against our competitors. So basically, the Navilas 577S Pro is the next generation after pattern laser. So we can do everything that the pattern laser does and more. So additional functionality, again, alludes to the benefits of speed, versatility, coupled with control and precision, and ultimately greater efficiency than conventional pattern lasers. At this point, I'm gonna hand back to either Sarah or to Dr. Ross. I think we are going on to some further clinical cases. Thank you.
We have the next slide. This is an area where I often use the navigated laser for my diabetics. We know that given the work at the Wills Eye Hospital and by Obed et al. On loss to follow-up, which is a category of proliferative diabetic retinopathy patients who may start treatment either with anti-VEGF therapy and intravitreal injections or laser and are lost to follow-up. We know that certain groups are higher risk. Groups under age 55, usually because of insurance issues, working, in certain ethnic groups, which is a sensitive topic today. We know that African Americans have a 30% loss to follow-up. Our Hispanic population has a 38% loss to follow-up, as well as our Native American population. So we're very sensitive seeing certain groups that may not be able to follow up, and I take care of a group from St. Vincent de Paul that's an uninsured patient population. So we have found that the navigated laser works very, very well. In this case is a 32-year-old Hispanic patient who's type 1, who's monocular due to a tractional retinal detachment combined with lattice degeneration, rhabdomatosis detachment in his right eye, and he presents with partial laser. He said he was last seen by a retina specialist about 4 years ago and has had some laser. He has a large frond of neovascularization superiorly, and we usually will combine an Avastin injection with PRP, and the navigated laser has been great because I don't use the contact lens. We use the navigated attachment that's a non-contact system that lets us put the PRP in. We put the PRP with never touching the cornea, then we go do the Avastin injection, and we feel like we've provided a comprehensive treatment if this patient doesn't come back to see us again, because they're working, they're moving, they're working in migrant farming. But many of my patients do come back to see me because they didn't have the same pain that they had when they were elsewhere being treated. So I want to really emphasize, our first mission is public health and making sure people are able to maintain vision. We know there are economic consequences for our diabetics when they lose vision and are unable to work. And that's why I wanted to share case 2, our ability to treat monocular patients, not use a contact lens, and do a complete PRP with an injection in the same day, and have them be continued to follow up. Can we move to the next case, please? We see many patients in our practice from other countries, and this was a 16-year-old high school student who is here doing an exchange program. He does not have insurance and wants to play basketball. He has a screening exam and he fails with one eye, so he is seen by a local optometrist and referred for leakage. We found him to have undiagnosed Coats disease. So to be able to treat him once again in the office and to treat a minor, many of our minors are very nervous, and parents go to Dr. Google and they hear about how much pain a laser was. So we were able to use, by convincing the family that there would be protective zones, what I call no-fly zones or protective zones, down in the bottom right corner. Those are those yellow spots you can put anywhere and you can make of any size. And the patient was very comfortable sitting and tolerated treatment with finding all the small aneurysms and telangiectatic areas. And we've continued to treat those. Those can be very resistant to treatment, but knowing that you're going to have follow-up is very, very important. And I think our patients, when they have pain, they have discomfort, they're worried about a contact lens, they're a little nervous and they may not come back. But at least for treating minors, we were able to do all of his treatment in our office, so he did not have to go to a surgery center and have excessive fees. So I just wanted to share that case with Coats disease, and the minor continues to be able to tolerate laser treatment for those small aneurysms.
At this stage, I'm going to come back to some further options for the Navilas 577S Pro. So the Pro is your entry into navigated lasers, but it doesn't prevent you from adopting additional functionality further down the track. There are upgrade packages, advanced comfort package, integration package, reporting package, and teaching and training packages available. And with teaching and training in mind, I'm going to hand over to Sarah again for the Navigate app. Sarah, please.
Thanks, Bernard. I appreciate that. So, just a quick brief history sort of on this app. Based on customer feedback and dealing with teaching hospitals more and private practices as well, ODOS really saw a need for a platform that allowed doctors to discuss and collaborate on laser cases. So in response, we've created the Navigate app. It's a free app that you can download onto an iPad. And it allows doctors to develop and discuss treatment strategies for different cases. It's independent from the system or the laser system that you currently use as well. Collaboration can be achieved, on site for small groups. It can be projected onto a screen for larger groups. It can also be used on an online platform like we're doing today as well. And so next slide, please. We will show you a quick video here real quick. As you can see, kind of gives you a better impression of how a Navigate is used. The user can upload images from just different diagnostic office equipment, such as fundus photo, FA, thickness maps, among others. Next, lasers can be planned, or rather treatments can be planned after discussing the diagnosis. Caution zones are laid down. The user can put down single spots, as you see there. They can also put down a grid like they would for any pattern laser as well, and they would just paint that on, just like you saw Dr. Amorosa do earlier in the presentation here. They can take off of blood vessels, and then lastly, the user can sort of run through a simulated treatment, as you see here on your screen, just going consecutively one after another here, avoiding any of the areas that were not supposed to be treated, which can be discussed as well, especially for residents or places with novice doctors or users. Yeah, we really feel like this tool can really help support virtual conferencing, digital training routines, but of course also on-site courses. You see there that the user just exported images as well, which is great. Okay, next slide, please. So we are now in our question and answer session, but as a reminder, you can also use the chat function in order to answer or get any questions out there for anybody.
Written questions.
In the chat.
Yes.
Perfect. Let me see.
I can read the first question. So it says, how exactly do the upgrades work? Maybe that's for you, Bernhard.
He's muted.
Yeah. Can you try to unmute yourself now? Wait a second.
There we go.
Yeah.
I'm back. So yes, the upgrade options work quite simply. So you are the proud owner of a Navilas Pro system and you decide you want to add some features. You get in contact with us and we will provide you with a quote for an upgrade package. They are available as a perpetual licensed feature upgrade package or as an annual license package if you want. And yeah, they enable you to upgrade flexibly to the full functionality of everything that Navigated Laser has to offer.
It's like, so while we're waiting for more questions, I've actually got another question for Dr. Ross, if she would be so kind. I was kind of curious, what's the question that you get asked the most by patients that you're preparing to do laser on?
Robin, you have to please press on the microphone to unmute yourself. Yes, thank you.
I think the biggest questions are, will I go blind? What are the risks? Because today they can go on to Dr. Google and put in laser and they think laser is synonymous. There's only one in the whole wide world. They don't understand that I could get a laser off eBay and do a focal or a PRP. We've advanced, and so I put it in the setting of we've advanced tremendously in our pharmacologic therapy, but Navilas takes us into the 21st century with laser treatment, just like we did with pharmacologic therapy. And that it's much more precise, it's much more protective. The likelihood that we're going to see a laser burn in the fovea is extremely low to none. And that is really comforting to them because of what they've seen on the internet. But I tell them I have to still consent them and report all the complications that have been reported from focal laser based on the code we use here in the US. So I'm very honest with them that yes, we still have to consent them that is a risk, but this is what we're doing to mitigate that risk. And they are very grateful once they understand the advancement in the technology.
I guess that's probably the part where you tell them that the laser tracks. We can mark specifically where we don't want the laser to fire. I'm sure it makes them feel a lot better, especially for maybe your monocular patients. I know that you mentioned that one of the cases that you presented today was actually a monocular patient with very bad vision in the other eye. So.
Yeah, I had 10 patients today, 5 monocular. So I do have a lot of monocular patients who come see me. And that's why we were very careful in crafting our practice. This is my 4th pandemic, and we built our practice with social distancing as part of our platform. So we could spend 30 to 40 minutes with every single patient. So our patients were already spaced when COVID-19 broke out. But Navilas and navigated laser has been a method to grow our practice. The higher satisfaction of patients today means they tell their neighbor, their friend, their cousin, the person next door. Social media is pretty powerful. So the next door apps, people can recommend someone. So if they have a good experience, which means to me, the doctor has spent the time, has explained to them how to mitigate risks, and has showed them the post-laser. I can share the screen with them, and a lot of them stand up and see their tear, their hole that they saw in Aptos. Now they're in the laser room and they see the laser around it. You can see sort of their anxiety leave them. They're walking out knowing they've just seen it, that they have been successfully treated. There's no, I don't know, I didn't see my tear, I'm not sure if it's treated, I still have these floaters, and they have that high anxiety. So alleviating that anxiety is part of what we do as physicians first, an ophthalmologist second, retina physicians third. And preventing blindness, 85% of blindness is preventable. So if we can educate patients, they'll come back for treatment in their other eye, or their family members will come for treatment.
It's a great point, and I'm glad you brought that up because people, if we have users rather that are watching this now, or people that are not familiar with Navilas, you can actually turn the screen around so that the patient can see what you've done or what you've planned. So it's nice to be able to give that application. It's the same thing you do with your diagnostic testings. You turn the screen around and you say, look, this is what's going on with you. But now, even better, you can turn the screen around on the actual device that you're treating them on and show them this is what we're going to do and this is what we've done, which is nice. So kind of adds that extra comfort for the patient.
Sarah, I have here an open microphone from Dr. Shako. I think you also wrote a question. Do you want to ask the questions to the auditorium?
Let me see. Unfortunately, I can't see that on my side. I can see a little bit of it. Let me see if I can expand it. Give me just a second.
Dr. Noor,
Okay,
I see your microphone. Wait a second, Sarah. I see 2 microphones that are released of participants.
Sure.
So you could now speak if you have a question.
Yeah, my question is this, that if the patient moves he had a lot, then does the computer takes care of that? That movements, I know small movements can be taken care of, but what about the large move, like significant movement?
Dr. Ross, would you like to answer that, or I can follow up?
I have a lot of patients with tremor, and the tremor is not a problem. We usually have a staff member kind of gently guiding their head, but the tremor hasn't been a problem with laser treatment.
Yep.
Okay,
So it does
thank
have I'm sorry, it does have a tracking capability, but also that point, so say the patient moves out of view, the laser will actually stop firing because it can't see the patient's eye, and so the tracking keeps the laser from continuing to fire. You have to bring the patient back, put them back under the view, and then the laser has to see the back of the eye in order to continue the treatment. But it picks up exactly where it left off. So I hope that adds to that question.
Yes, it has. Thank you very much. Thanks.
You're very welcome.
This is Dr. Fernando Revalo from Johns Hopkins Wilmer Institute.
Hi.
Hi, how you doing? Thank you all for the presentations. I really enjoyed it. I have had a lot of experience with different lasers in South America and Saudi Arabia, where I spent 4 years at the King Khaled Eye Specialist Hospital, and we had the Navilas Laser there. I work a lot with Igor Kozak for 4 years. I actually hire Igor to come with us, work with us there. And now we have the Navilas at Johns Hopkins. And one of the things that we did at King Khaled was treat patients with diabetic macular edema with Navilas combined with anti-VEGF therapy, and noticed a reduced number of injections with Navilas therapy combined with pharmacotherapy, with anti-VEGF therapy. I wonder if Dr. Ross has seen the same thing in her practice. And we're hoping that we can pick that up, those studies at Hopkins, now that we have the machine there. Unfortunately, the pandemic era has stopped a little bit everything we were doing, especially research-wise. Dr. Ross, please, I know you were going to answer.
You had excellent points. I have found we've been using the micropulse for both central serous and for diabetic macular edema. We're using it more and more as we get more positive benefits. I've actually seen a lot of patients with branch retinal vein occlusion who, after several anti-VEGF injections, doing the micropulse, they're staying dry. And to reduce our injection burden is very, very critical. And I have really been pleased with that. As I gain more experience doing that, I think it's a real benefit.
Well, you just mentioned a very important indication right now of the machine. If we use it with the micropulse mode for central serous curve retinopathy, there are some patients that do not respond to PDT. If patients don't respond to PDT, there's nothing else that really we can do. If there is no choroidal neovascularization and anti-VEGF is not the answer, then micropulse is the answer probably in those cases. And Navilas has a really nice function for that. Thank you.
Thank you for that question. Appreciate that. Any other questions? I'm looking.
I don't have more written questions here.
Okay. Dr. Ross?
I did want to make one other comment. Unfortunately, it only pertains to our U.S. participants. We're seeing a trend among healthcare insurers asking for any kind of laser report. So we are downloading, we have the original Navilas, so we're downloading the PDF into our electronic medical records for our billing team, and they're now attaching it to every focal laser 67201, so that we don't have a 3-week delay as the insurance company comes back and says, can you send us a laser report? With they're starting to do this like they do with our vitrectomies, asking for a operative report. So I think even with the professional, you have PDF capability to do the drawing and say how many spots you put and where you put them. But the original allows us to download the PDF with all the exact spots, millijoules, and milliwatts.
Yep.
And let me add to that, if you want to fully integrate the Navilas Pro into your digital workflow, that's possible via the integration upgrade package. There's a DICOM interface included. So not only can you pull up patient information, you don't have to manually enter it at the laser system anymore, but you can also fully automatically export the reports that you generate after the laser treatment. So you can actually automate that workflow pretty much. Yeah.
Good. Any other questions, Stephanie, that you see on the board?
No.
Okay. Are we good to move on, I guess?
Yes.
Okay, perfect. Thanks so much for all your input, Dr. Ross, and everybody else for asking the questions. We appreciate that. So, you know, for anyone else that is interested in any clinical experience with navigated laser treatments, you can always feel free to check out our expert library. It's on our website. You see the website there at the bottom of the screen. It's www.od/os.com/experts. And there's a lot, it's loaded with cases, you know, a bunch of really great information. I always share it with my sites when I go places. Some of you may already have that link, but please feel free to find that on your own. Lastly, with that, we really thank you for your time and interest. I want to give a special thanks again to Dr. Ross for her time today. We know that she, as well as everyone else that visited us today, is very busy. We don't take that for granted, so we appreciate it. Thank you very much, Dr. Ross.
You're welcome.
Yeah.
Thanks for having me.
Oh, it was our pleasure. Thank you. For any more questions on the Navilas 577S Pro, you can please feel free to contact us. My contact information is there. But also, if you have any questions for Dr. Ross, she's been kind enough to offer her information as well. So again, thank you again, Dr. Ross. Thank you, Bernard, for your help as well, and Stephanie in the background for moving the slides for us and making it happen. So thank you.
Thank you. Bye-bye.
Bye.
Bye.